Hey guys, good morning. This is Amanda Brooks coming to you live from Bangor, Maine. Wearing a hat today. Didn't feel like doing the hair, so pardon my appearance. But for those of you who haven't tuned in before, I am a physician assistant. I've worked in emergency medicine for 14 years, and really it's my goal to help bridge the gap between modern and alternative medicine. And what I want to talk to you guys about today is calcium supplementation. For some reason, I am still seeing calcium supplements on so many patients' med lists. I have to wonder, is your physician taking the time with you to talk about the risks and the benefits of both supplements and drugs? Now, when we look at prescription drugs, over 100,000 Americans are dying every year from properly prescribed pharmaceuticals. This is alarming. Hey, good morning, Misty. Good morning, everyone. And so supplements are no different. I think oftentimes what happens is physicians recommend supplementation because they don't think that there are any adverse effects associated with such. Okay, so I'm going to talk to you a little bit about calcium pros and cons. Okay, so first of all, back in 2008, there was a study in New Zealand, you guys. It looked specifically at calcium supplementation, and they were seeing some promising things. They were seeing that there was some dips in patients' blood pressure numbers, but unfortunately, this only lasted a few months, so it was transient. But what they saw is they saw that the excessive amounts of calcium in people's guts caused the malabsorption of fats. So they got really excited. They got excited that if we weren't absorbing saturated fats, that this could in turn decrease our cholesterol levels and perhaps could help us to prevent heart attacks. So there was a time and a place when people were told to take calcium supplements to help decrease blood pressure and heart attack risk. Okay, but guess what? That didn't happen at all. We know that calcium supplementation actually increases the risk of heart attack and stroke. Now, initially, the supplement industry, they were really alarmed at this. They were thinking, oh my gosh, these researchers, they're just creating a ruckus. They're just asking patients if they've had issues with their hearts, and they're taking the patient's word for it. And the reason why they thought that is because people that are on long-term calcium supplementation, they have 2, 3, 4 times the risk of hospitalization secondary to the GI symptoms that they're experiencing from their calcium supplement to get ruled out for a heart attack. But this is what happens. Let's really think about what happens when we take a calcium supplement. Okay, so when you take a calcium supplement, there is absolutely nothing natural about it. You take the calcium supplement. This increases the amount of calcium that's in your blood, and it does so for a sustained amount of time, like somewhere between 2 and 8 hours. And what that does is that makes your blood more viscous, hypercoagulable, more likely to form blood clots. So if your blood is more likely to form blood clots, then you are at a increased risk for heart attack and stroke. Okay. Extremely alarming. So do you need to be worried about eating calcium through green leafy vegetables, spinach, bok choy, broccoli? No. Okay. So then I'm trying to be, thinking about both sides here. Now, can the risk-benefit ratio be beneficial for calcium? In other words, I know that women that sustain hip fractures, their mortality is horrible. For instance, I believe that 1 out of 5 women who sustain a hip fracture will die within the year. Okay, so now if we can prevent, and I think it's even worse for men, unfortunately, but so I'm thinking, hey, if we can prevent hip fractures through the supplementation of calcium, would it still be beneficial to take calcium despite knowing that it increases risk for stroke and heart attack? Well, no, because randomized control studies show us get this, drum roll, because I think a lot of you are taking calcium supplementation to prevent fracture. We know that taking calcium supplements increases the risk of hip fracture by 64%. That's disgusting. So I'm just hoping that you guys are watching this with an open mind. So then I was looking at a study. I wanted to look at a study of individuals taking calcium to see exactly what transpired. So there's a small study looking at 1,000 individuals. They started supplementing with calcium, and get this, 14 had heart attacks, 10 had strokes, and 14 died, okay? Now, there were some fractures, risk fractures and stuff, 27 of them that were prevented, but look, 14 people died unnecessarily. So they were actually going to the store, buying a supplement that caused them to have a stroke or a heart attack that they wouldn't have had otherwise. So honestly, I'd rather deal with a broken wrist than die of a stroke or a heart attack. So anyway, not trying to tell you guys what to do, simply trying to educate you and make you more aware, because doctors, physician assistants, nurse practitioners, naturopaths, anyone that you're seeing that you're trusting your healthcare with, you guys have to still be your own advocate. You have to advocate for yourselves, and you have to ask yourself, is this safe? So make sure that you're educating yourself on decisions, and make sure that you know exactly what you're putting into your body, because no one's going to take care of you like you'll take care of yourself. So hey, I hope that you guys have found this helpful, that you found it educational. Please, if you know someone who is taking calcium, if you yourself are taking calcium, rewatch this, think about it again, and guess what? You can get all of the calcium that you need from your diet, okay? So the next question, actually, before I conclude, is going to be, I know my mailbox is going to fill up. How much calcium do we need? I think that as Americans, most of you that are watching this are American, we get so hung up on numbers. But our bodies, like I've educated you guys in the past, they're amazing. If we give our bodies what they need, they can heal themselves. So the big question is, how much calcium do you need? So if you talk to someone in the UK, they recommend 700 milligrams. If you talk to someone here across the way in the United States, we recommend about 1,200. So somewhere between 700 and 1,200, or even 500 and 1,000. Anyway, just eat a lot of green leafy vegetables. And like I said, the reason why our bodies are so amazing is because if you're not eating a ton of calcium, guess what? Your body, it absorbs more calcium, holds on to it. If you're eating an excessive amount of calcium, your body doesn't absorb as much. See, pretty cool. So anyways, hope you guys have found this helpful. Get out there, eat your green leafy vegetables, share this with someone who's taking a calcium supplement. And anyway, thanks for everything, and have a great day, guys. Bye.